All right, so let's talk about the temples. This is a little bit of a tricky area to do because the skin is so thin and it's a little bit difficult to place filler and not be able to see the filler. That's been my challenge in trying to figure out how to do this and not use too much product. Some people have quite a deficit in the temples. When I first learned how to do temples, I was using Radiesse to place deep in the temples, and there's two problems with this. One is that you're going to go through a lot of product. So the thought there is that you'll just place a whole syringe of filler on each side. So one, you've got 2 full syringes of filler that people have to purchase. And even then, with 2 full syringes, and I've had this done to myself, and it makes a little bit of a difference. But if you've worked with Radiesse, you know that it kind of warms up and swells great, fills a deficit, and then just kind of settles. And often you'll need to place another syringe on top of that. So that's one big problem, is the amount of volume of product if you place it deep on the bone. The second problem, and you'll realize this once you take a cadaver course, is that the temporal muscle is adhered so tightly to the skull that I now feel like after a few cadaver courses, it's impossible to inject deep under the muscle. Every single time I've tried to inject a cadaver with filler, the filler is really bubbled up into the muscle because there's just no way to separate it from the bone. After seeing that a couple times, I decided I definitely don't want to do that. So then I've gone to just using cannula or needle. Here's the problem with cannula or needle. Because the skin is so thin there and there's just not very much fat there to soften the filler, you can end up seeing the filler. You can see either like the edges of it where it ends, or you can even see the cannula strips where you lay down the product. And if you don't dilute the filler at all, even though you massage it after placement, often you can still see those lines. Now, I'm not saying this is going to happen every single time. You could do it once or twice, 5 or 10 times. It could be perfect, but you're going to have a client who comes in, you're going to place this filler, and you're going to get a call a couple days later, you're going to get a call a couple months later, and they're going to tell you that they can see it in pictures or a friend pointed it out. Now, if you're using Versa or an HA, you can dissolve it. If you use Radiesse, obviously you can't dissolve it. So that's a problem. I would not use Radiesse in this area because of that. You need to have a product that you can adjust if you need to in this area. Very important. Now we have Versa or another HA product. Again, I'm going to use the Versa because I love to add the PRF. You can add, bacteriostatic normal saline. You could add lidocaine if you're not using PRF yet, but it's not going to be as silky of a consistency as if you use the PRF. When you use the PRF, it just makes a very nice, thick and moldable consistency that's just better than when you mix it with water. I'm going to recommend that you do a 1:1 or a 1:0.5 if you want it a little bit thicker. But when you're starting, I'm going to recommend you do a 1:1, so 1.2 Rejuvenation to 1.2 PRF. And you're going to use that for each side. You're going to use a 22 gauge 2-inch needle, and you're going to numb the cannula site with Septicaine. Here's why. People get very nervous about the temple, just like they get about the tear trough. Even though it's a relatively easy area to place product, they get very nervous. And because you're so close to their ear, they can hear every single sound of you putting the cannula in, of you injecting the product. And because the tissues are pretty tight in that area, they can feel the pressure of you separating the tissues as you move the cannula through and you lay the product down. For those reasons, you want to have them as comfortable as possible. And if they're already nervous and then they're getting queasy by the sounds and they can feel the pain of where you're going in with the cannula, which is heightened just by anxiety. It's not a painful procedure, but as you know, anxiety causes heightened pain receptors. Do everything to keep them comfortable. This is an area where I find that people vasovagal very easily. I've had a number of people pass out on me or come very close to passing out when I'm doing the temple. So I like to have ice behind their neck, even sometimes an ice pack right on their chest where they just kind of hold it there, numb the cannula site, and just kind of talk to them the whole time that you're doing the procedure. Again, it's very simple, but it's just about having the right consistency of product and having the patient feel very comfortable while you do it. Once I place that whole volume, so it's going to be a total of 2.4 mLs, which often is necessary unless they just have a slight deficit, then you're going to do a nice little massage. You're going to put a little Aquaphor over the opening and then go to the other side. You do need to tell them that it's going to swell. It's going to look overfilled. Just to relax. Within a couple of days, it will come down. And with the first few times, make sure that you see them back so you yourself can see how it lays down and how nice it is. So that is my recommendation for temples. Always add either normal saline or lidocaine, but preferably PRF to this area, 1:1 concentration, and see them back in 2 weeks for their final pictures.